So I put together a checklist for labour and birth for my clients, which you can download on my website. And it's just a few pointers to think about when you're in labour and birth, about what you might need to keep you focused, to keep you at the centre of things. It's useful if things seem overwhelming or if progress should slow, if you're not sure what to do next. It's just worth having a look through because it can kind of, as I said, give you that focus on what might make a difference. So, are you in a comfortable position? Do you need to change position? Where are you? Could you be more upright? Would that help? Because sometimes in labour, I think there can be a lot going on, and you're not sure about what to do next for the best. Are you using your breathing? Are you able to use your breathing to stay as calm and as focused as possible? Quick reminder to kind of get back to letting go of that tension, slowing all your breathing down, see if that kind of brings that calm and maybe that clarity that you need so that you can change things and maybe move things along a little bit. If you're knackered, are you able to rest? Is that possible? What do you need to be able to rest? If there's enough of a pause in between contractions, how can you make that rest happen? Can your partner support you? Um, Are you going to the loo often enough? Thinking about how long it's been, even just um the kind of the activity of going to the bathroom, sitting on the loo, relaxing everything, even if you don't need to go to the loo. Again, it's a place we're familiar with for relaxing the pelvic floor. So if there is tension and you're feeling a bit overwhelmed, the bathroom can be a place to stay in for a bit because we do automatically, um, we feel quite comfortable in a bathroom and we're just relaxing our pelvic floor and just sitting on the loo for a bit. That can work wonders in labour, especially if it feels like it's stalled and you're not making any progress. Do you need to eat? Are you actually just running on empty? Um, you know, what 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 have you got? What do you need? Bananas are great, fruit, honey, things that can give you a nice burst of energy. So not necessarily chocolate or things that are empty nutrients. Something that's got a bit more power to it can make a difference. Are you drinking enough water? Especially if you're having gas and air, you can get dehydrated and dry mouthed really quickly. So just make sure we're not talking about drinking pints and pints and pints, but just regular sips, just to kind of keep you going and keep you comfortable, because that can give you energy as well. The last two questions are just like being really honest with yourself. What is it that you need right now? And that can be a great way to focus your thoughts on what's really important, because it could be pain management, it could be to rest, it could be to have information and reassurance to know what's going on. For some women, it could be for this to end, and that it's an indication of where your head's at and what you need and what conversations need to be had, how much energy you've got left in the tank to keep going. Sometimes these big conversations need to be had. Um, and sometimes there's a difficulty in discussing the realistic next step options because somebody's been, I do work with a lot of women who are like, I really don't want an epidural, I want a water birth, I want to do this as naturally as possible. But the reality of how their labour's unfolded is that that's a challenge and that's not going to happen. So you need to think about or to have an awareness of and an understanding of what are the appropriate next steps for you. And for some women, that could be an epidural so that you can rest, so that you have a break from the contractions, so that you can kind of later refocus for the birth. For some women, the next step is going to be a cesarean, depending on the scenario. So thinking about what do you need can be that conversation starter about where this needs to go next. And then as part of that is, do you feel safe? Are you overwhelmed? What's overwhelming you? What needs to change? So they're kind of very much linked in this way. Let me just stop sharing that. Sometimes labour and birth is really straightforward and it requires not a lot of additional support. It works, it's efficient, it's effective, it does what it should, you know. For other women, it's much more it's less straightforward. It's a bit more stressful. It's harder to stay focused. Different decisions need to be made. And that can just be what labour and birth is like. It's unpredictable, and I don't want it to sound kind of scary and negative, but I think realistic birth preparation is about knowing that there can be some twists and turns within that, and that different decisions are made. And we're not talking about emergencies, we're just talking about a labour that's slow and ploddy, a baby that's not quite lined up, and sometimes that impacts what options are available, what decisions need to be taken, and that's all okay. What makes a huge difference is communication and being able to say what you need, to be heard and listened to, and to be communicated well back. So it makes a difference if you're able to communicate some of that and to encourage that communication. It just helps, really. So again, I think as part of your preparation, do write down any questions, any concerns, anything where you think you might need support, anything that you don't understand as part of going through these videos, because as I said, sometimes it's really straightforward and other times you just need to ask more questions, and it's just having the confidence to have a bit of a voice and to place yourself at the center of things and to try and demand the care that you need, which sometimes feels lacking because midwives can feel busy, and there can be a feeling of, I don't want to bother her, but this is the birth of your baby and that's important, and you're important and you matter. So, and your experience matters as well. So it's having a voice within that makes a huge difference. Okay.